Good morning. We're going to get started in about 2 or 3 minutes. If everyone can mute their microphones. Good morning. We're about to get started in about another minute or so. If everyone can mute their microphones, and we will start. And at the conclusion of the presentation, we can all turn our cameras on and chat. Okay, good morning. We are going to get started. Just if you can quickly in the chat box, let me know if you're able to see the PowerPoint. You can just drop a note into the chat box. I'm still allowing people to come in. When you come in, if you could just mute your microphones, we're about to get started. Okay, and just mute your microphones for me. Thank you. Awesome, you can see. Great. So I should let you know that this presentation is being recorded. And if you stay on the Zoom call, you are consenting to being recorded. You are not required to have your cameras on or your microphones, nor are you required to speak, but I would hope that once the presentation is done, that you will join in a conversation. So we are going to go ahead and get started here. And I will continue to allow people to come in as we are going forward. I've received a few emails that said that they wanted to join. So welcome to Beyond Boundaries, and thank you for joining the conversation. Today, we are talking about understanding and supporting communication in individuals with Moebius Syndrome. So I want to thank you for taking your time and joining us today to have this conversation. So Moebius syndrome, what is it, and what causes it is the next question. Moebius syndrome is a rare congenital neurological disorder which is characterized by facial and sometimes limb paralysis. So being that it's congenital, that means that it occurs in utero. It is present before the child is born. It was named after a 19th century neurologist, Paul Moebius, although Dr. I always butchered his name, Graffe, who is a German ophthalmologist, was the first to describe it. So what causes Moebius syndrome? The cause is not fully established. It's just that rare, but congenital facial weakness and the ability to abduct the eyes, which means to move the eyes away from the nose. So like use your peripheral vision, so to speak. in one or both eyes must be present for a diagnosis of Moebius syndrome. The syndrome typically presents with the absence or underdevelopment of facial nerves and of the facial nerve, which is cranial nerve 6 and 7, and lead to limited or absent facial expressions, as well as the inability to, like I said before, use peripheral vision. So, statistically speaking, the prevalence of Moebius syndrome is estimated to be around 1 in 50,000 live births. That's just how rare it is. There's an equal incidence among male and female, and it has there's no difference uh, based on race or ethnicity. Moebius syndrome can be associated with other syndromes such as Poland syndrome, Pierre-Robin sequence, Carey-Feynman-Zeiter, and Klippel-Feil. And it can also manifest with, like I stated before, hand and feet anomalies. So while you don't always see it, um, you could have a patient that has missing digits and or club foot. So some key features of Moebius syndrome include facial paralysis. This is the most prominent characteristic. Individuals with Moebius syndrome often have difficulty moving their facial muscles, impacting their ability to smile, frown, or make other facial expressions. The absence and underdevelopment of facial nerves 6 and 7 is what leads to the absent facial expressions. So if you look at these pictures here, the picture on the bottom right corner of the African American male, he seems to just kind of have like a very flat affect. That's what you would tend to see. Um, Cranial nerves 6 and 7 are the most frequently affected. However, other cranial nerves, including the third, fifth, eighth, ninth, 11th, and 12th cranial nerve, can all be affected. And I have a little brain here that gives you the name of the different cranial nerves, and we'll look at that in the next slide. Another key feature is eye abnormalities. Impaired lateral eye movement and difficulties closing the eyes fully are common due to the involvement of the abducens. So that's the sixth cranial nerve. And that is the sixth cranial nerve. And then the third cranial nerve, which is the oculomotor cranial nerve. Those are the cranial nerves that affect and control your ability to control your eye muscles. People with Moebius syndrome often present with speech and swallowing difficulty, very simply because of again, the facial nerve being paralyzed, and that can be either unilaterally or bilaterally. So it can occur on one side of the face or on both sides of the face. One of the first symptoms that presents at birth is the inability to suck. So oftentimes, the infant or the newborn will present with tongue tie, and they're not able to get a proper latch onto the breast. So that could lead to swallowing, feeding, and choking problems. You'll often see excessive drooling in people with Moebius syndrome. So if you look here and you see the little boy here, you can see he can't fully close his mouth. Same as with the older Caucasian lady here. Her mouth is open, so you would see probably drooling and or dry mouth, because not being able to close your mouth with could lead to that. Let's see here. Limb anomaly, say that 3 times. While not present in all cases, some individuals with Moebius syndrome have limb abnormalities, as I stated earlier, missing fingers, clubbed feet. Sometimes an entire hand will be missing. And the interesting thing about Moebius syndrome is that it's variable in its severity. So on the spectrum, there are people who have Moebius syndrome, and the only visual symptom that you can see right off the bat would maybe be a unilateral paralysis on part of their face, or maybe not even that. You might have someone who they just have an inability to abduct their eyes and look left or right. So it wouldn't be as obvious as one of the persons in the picture that I've included. Um, when it comes to intellectual abilities, interestingly enough, approximately 30 to 40% of children with Moebius syndrome have some degree of autism, but in general, their intellectual abilities are typically unaffected, and individuals with Moebius syndrome are expected to lead fulfilling lives with the appropriate support. Here's just a little table of the cranial nerves and their primary functions. And it just gives you some insight on what each cranial nerve does. If it's sensory, meaning sensation, and or motor, meaning movement, or if it's both, right? So when you look at the facial nerve, which is number 7 here, facial nerve, it's sensory and motor. So it controls the muscles and facial expressions and the taste from the anterior tongue, as well as lacrimal and salivary glands. So considering that, and that being one of the most prominent affected nerves in Moebius syndrome, you could see why facial paralysis would present, because that cranial nerve has been damaged and or is underdeveloped, as well as cranial nerve 6, which is the abducens nerve, that is motor, and that's eye movement, meaning that you can't move your eyes away from the midline of your nose. So, as I stated in the previous slide, other cranial nerves are affected. However, 6 and 7 are the most prominent. And Moebius syndrome is a has sensory motor deficits. So people with Moebius syndrome have sensory motor deficits. So what are the communication challenges that people with Moebius syndrome face and their communicative partners? Because if you're communicating with someone who has Moebius syndrome, them having a limited facial expression can make it very difficult to understand how they feel and or if they understand you or what they're thinking. So that difficulty or inability in making a facial expression, including smiling, frowning, raising your eyebrows, just being able to look surprised or scared or shocked. These are all things that are important for nonverbal communication. And that is a challenge that the larger part of the population of people with Moebius syndrome face. Another challenge that they face is impaired lip and tongue movement. They have challenges in coordinating lip and tongue movements that affect speech and speech sound production. So oftentimes their articulation will be off and they can be difficult to understand. I've seen one case where the patient, he could only move his lower jaw. So he had no movement of his lips, and he could only open and close his lower jaw. So that really affected his intelligibility when it came to speech. Um, Again, reduced eye contact and blinking, the limited ability to make eye contact because they don't have control over the oculomotor nerve, the abducen nerve, that can make it difficult, again, for nonverbal communication. You may not feel that they're paying attention or that they're looking at you. Strabismus is often, which is cross-eyed. Strabismus is a medical term for being cross-eyed, as we call it. That is something that you'll often see with people in Moebius syndrome because they lack the motor control for their eyes. Again, 4, speech sound errors, articulation difficulties. 5, challenges in nonverbal communication. We can understand why that occurs because, again, the lack of ability to make facial expressions and gestures to convey emotions, intention, and emphasis, because we talk a lot with our body. Our nonverbal communication speaks as loudly as oftentimes our voices do. Um, a lot of people in children with Moebius syndrome, they have social interaction difficulties and challenges in navigating social situations due to a lack of typical facial expressions and gestures and the inability to use that nonverbal communication. If you think about it, you probably have a friend that you could look at and you don't have to say anything, but just very simply by the look on your face, they know exactly what you're saying. People with Moebius syndrome cannot do that, or they have difficulties with doing that. Uh, Potential language delays. So speech and language development could be delayed, particularly if there are associated difficulties in their oral motor coordination, voice quality and resonance issues, having variances in their voice quality or resonance due to differences in control of their vocal cords and oral structures. So cranial nerve, I believe it was 8 and a few others are affected, and that affects your vocal cords. So they could have varied pitch or have a very unique and or different sounding voice. And if you think about that as a child, that could really bring a lot of unwanted attention. And even as an adult, uh, and some people with Moebius syndrome present with swallowing and feeding challenges. As I stated at the beginning, that one of the very first symptoms in neonates is the inability to latch onto a breast or suckle, right? Um, so considering that some people may experience difficulties with swallowing and feeding, that can impact their overall health and nutrition. And so that is another hurdle that people with Moebius syndrome have to take on. Then you have the psychosocial challenges. Potential psychosocial challenges can be related to things like their self-esteem due to difficulty with social interactions. Um, Children, as a child, they may be aware of their unique communication differences or the visual difference in their face versus one of their peers, and that can really um, affect a child as with any other child. But here is a child with additional issues. They may be missing digits. They may have clubbed feet. Their face doesn't look the same as their peers. They can't express themselves the same. So these are all challenges that can face people with Moebius syndrome, and that can lead to difficulties with participating in school and in the classroom, giving presentations, standing up and giving your answer, going up to the board to do your answer, to provide your answer. So those are all things that communication challenges that they face. So while there's no specific treatment for Moebius syndrome, because again, on the spectrum of things, you have people who go from really mild to people who could be really severe. And in all actuality, every person that you interact with and or treat, if you are a healthcare provider, will be different. No two people with Moebius syndrome are alike. Each one is very different from the next. So treatment is supportive and in accordance with that specific patient or individual's symptoms. This means that family members and medical providers have to work as part of a multidisciplinary team to support the individual. There are options such as surgery that could correct strabismus or crossed eyes and improve limb and jaw deformities. There are some options out there where surgeons can do a nerve and muscle transfer to the corners of the mouth to provide limited ability to smile. Uh, you also have the option of plastic and reconstructive surgery, because there are some cosmetic as well, challenges that a person may want to have corrected. So plastic and reconstructive surgery may be beneficial in some individuals. Physical and speech therapy often improves the motor skills and coordination and leads to better control when it comes to speaking and eating. Um, and there are other persons that are part of that multidisciplinary team, such as dentists, respiratory therapists, ophthalmologist, and the list goes on. It just really depends on what deficits that individual has. So how can a speech therapist support communication in a person with Moebius syndrome? When they have articulate, we could provide articulation therapy that allows us to target specific speech sound errors to improve their overall intelligibility. We can provide oral motor exercises because, again, let's remember that this is a sensory and motor deficits in people with Moebius syndrome. So we can provide oral motor exercises, which will allow that person to develop the oral motor skills to enhance the control and coordination of their facial muscles. So we can work on exercises to improve the lip and tongue movements for better speech clarity. Speech pathologists can help work on the non-verbal communication and provide strategies for an individual that will allow them to learn how to make facial expressions and gestures and to use their body language to the best of their ability. That includes practicing smiling and trying to figure out how we can strengthen those muscles through oral motor exercises so that if smiling is important to them, we can see if that's something that can be achieved. As well as with nonverbal communication, you have the option of exploring augmentative and alternative communication devices. So this little picture of this little boy here, that's an alternative communication device, and it allows a person to be able to communicate through, some are electronic and they speak for you. Others are very simple and they have little, pictures and cards on them that have one word, and a child can take that word off and make a sentence, or point to a word to communicate their needs. So those are options as well. Language and comprehension interventions are something else a speech pathologist can work with in a patient, and that allows us to, what we could do is tailor therapy to that individual's language needs, or consider any additional language related challenges. So they may have deficits in the ability to understand like who, what, when, where, and why. They may have difficulties in being able to sequence a story. So that's something we would work with them on, because a lot of times these children are delayed, right, in their development. So considering that they're delayed in their development, a lot of times while they will eventually function on a average intellectual level, a lot of them face deficits in things like language. We can also work on social communication strategies and teach individuals how to navigate social interactions and understand social cues. This is something that we work with a lot with children with autism, because again, reading those social cues allows you to be able to connect with your peers. You can recognize when someone is disgusted, frustrated, or angry. And considering that 30 to 40% of most people diagnosed with Moebius syndrome have some degree of autism, this could potentially be a challenge. Voice therapy, where we could address any voice or resonance issues, teaching them how to control their volume if they speak too loudly, vocal pitch, if they have a screechy voice, things like that. Swallowing and feeding therapy. If it's a baby, we may need to have a tube put in for nutrition reasons. Um, if it is someone who is older and they still have failed to strengthen their swallowing muscles, maybe we could do some electrical stimulus therapy to help with the strengthening of their muscles, or refer them to a doctor for potential NG tube or PEG tube, things of that nature. So additional things that we as a supportive community, whether you're a speech pathologist, a friend, um, or family member, can do. I think as a speech pathologist, what I encourage other healthcare practitioners to do is to listen to the parents and the patient. Be patient with them, but listen to what their needs are, so that you can best know how to help that individual. You want to be an advocate and refer to other specialists. We have a specific scope of things that we can do to provide supportive treatment. Part of that as a speech pathologist is we may be able to provide some counseling in regards to being able to come to terms with the disability and the challenges that a person may face. But if they're dealing with significant depression, anxiety, then we would refer to a psychiatrist. If they're having behavioral issues, we would refer to a psychologist. We have to refer because that is what creates the multidisciplinary team that helps the patient and that individual and their family be more successful in life, despite this challenge. As a speech pathologist and just even as a family member, you want to do your research and be willing to think outside of the box regarding therapeutic intervention. Um, as a speech pathologist, you may need to combine approaches or develop new methods to meet that specific patient's needs. You want to respect the patient and parent decisions. Not everyone wants to have surgery to quote unquote fix the issue. And lastly, you want to remind them that they are one in a million in a good way, literally and figuratively. They are one in a million. So I have a video I would like to share of these parents talking about their child who has been diagnosed with Moebius syndrome. So let's hope this works.
Hi, baby. Snack. Snack? Yes. We'll get you a snack in a little bit. Can you go watch the movie? Yes. Okay, go watch the movie.
He's not gonna leave now.
Oh, okay, go watch the movie. The main thing with Moebius syndrome is the facial paralysis. So he can't make any facial expressions, smile, really move his face at all other than like his lower jaw and mouth. Angry face. Silly face. Sad face. Happy face. That's your happy face? He can't blink or move his eyes like side to side. He was also born with clubbed feet, so his feet were completely like churned in. And we noticed that on the 20-week scan when I was pregnant. And he had to do weekly casts. So they take your feet and they do weekly casts until they correct them, like overcorrect them.
Yeah.
And then he wears 14 hours a day of brace and bar medical shoes, and it like he looks like a little
Like a snowboarder.
yeah, he looks like a little snowboarder in those. And that was the main like limb difference he was born with. And then his left hand. He has a small underdeveloped left hand that was webbed, and he went under 2 surgeries for that to like cut the line. Do you see one? Where? So we do tell him that he has Moebius syndrome. We say it like on Moebius syndrome day. We celebrate it and say, "This is Moebius syndrome day. You have Moebius syndrome." He doesn't get it. He doesn't know what that means, but I like to continue saying it. I'm hoping it will eliminate that shock factor for him and us when the day comes and he asks, you know, why can't I smile? Why can't I do this like other kids can? So we do acknowledge it as much as possible to him, in front of him. We talk about it in front of him with other people. I get nervous about bullying and how he'll handle it. Yeah, and I hope he remains confident. So we'll see.
You'll have a lot of friends. It's fine.
Okay, so Moebius Syndrome Awareness Day is January 24th. So I would hope that you keep that in mind on January 24th and post something, even if it's just the link to the Moebius Syndrome Foundation, um, to help bring about awareness for these individuals. And I want to thank you for your time, for you attending today, for you joining the conversation. And now I will stop sharing my screen. We can actually have a conversation. So, hello. Thank you. Thank you. Thank you. Thank you for coming. You don't have to turn on your camera and you don't have to speak if you don't want to. But if anyone has any questions, I'd be happy to discuss it with you. Or even if you have any comments, I would be happy to hear. Thank you. Very helpful, very good information. Thank you.
So you answered some of my questions in the presentation. And I think with the video, the lady said that they detected something at her 20th week. And one of my questions was, could some of this be detected in utero, like, or if you're aware of like OBGYN processes when they're helping these people, helping women who are pregnant, are there ways for them to detect for this, or do you have to ask?
Right.
I guess
So,
just wondering how do you be proactive is really.
right. So that's a great question. So yes and no. Okay. So yes, if there's a deformity, right? If there's an obvious deformity, like that particular couple and that child, he had clubbed feet, right?
Mhm.
And so they could see that deformity and then they could say, okay, what are the things that we could be dealing with? Because there's multiple syndromes and or disorders that can cause club foot, but this is one of them, right? The other part of that is because they don't know fully what causes Moebius syndrome, it's very hard to detect. It's just that rare. I think there are about 300 people in the United States that have Moebius syndrome, I believe about 300 people. Um, and every one of them are different. Some of them have a genetic component. Some of them may have been exposed to teratogens. Teratogens are, drugs, alcohol, chemicals, all kinds of things. But what they do know is, and that's why the criteria for diagnosis is that they have the facial paralysis and the inability to abduct the eyes. That's the only criteria for diagnosis. And a physician, of course, would provide that diagnosis and then refer out for all the other supportive treatment. But as far as them just being able to do genetic testing, and no, not necessarily. And so it's a lot of research happening regarding Moebius syndrome. When I started to research it, I was really surprised. I did not learn a lot about the more rare disorders while in school. And so this is something that I do for my own continuing education, but also to bring about awareness about things that we work with as speech pathologists and how we can support families, but then just informing the community, because the more people that know, the more that we can provide support for families and individuals with this rare disorders like this so that they don't feel like outcasts, right? So the more you know, the more compassionate or kind you tend to be. But that was a great question. But unfortunately, not to my knowledge. I think it would be wonderful if there was a test because then at least parents can prepare themselves to handle the work that comes along with having a child with Moebius syndrome. So thank you so much for that.
No problem. I have one more.
Okay.
And I probably could Google this myself, but I don't know, you might know. But is it associated with any particular race, ethnicity, or gender primarily, or is it like equally
Prevalent.
prevalent in male, female ethnicities, races.
Yes, so it is equally prevalent in male and female, and there is no component of race or ethnicity that increases the likelihood of Moebius syndrome. So at this time, anybody could get it. It's kind of how it comes across. Um, Again,
So it makes me think that it makes me think environmental, or since the genetic component isn't there, you
it
know,
could be genetic,
and then right, it could be genetic,
right?
but since it's so, who knows,
Right.
it makes me think then maybe it's environmental, but then that might not be the case, because you would think that that pattern would have shown up in research
Right.
at this
And
point.
right. So that's the thing. I read one research by Picaro et al. And they had 50 children, and they were comparing 50 children in Italy. It was a research that was done in Italy. And these children all presented with a particular issue. I can't remember what it was. But the children here in the United States that were being researched at the time didn't present with any of, oh, they all presented with a particular genetic um, component, whereas the children here in the United States did not have that at all. And they still had some of the same symptoms and deficits and like missing digits, the strabismus, and or the ability to adduct the eyes. So they all fell under Moebius syndrome, but it's so rare. The population is so small that it's extremely difficult for them to pinpoint what it is. There are multiple schools of thought, like you said, environmental. They're thinking like, is it teratogens? Is it? But again, you would have more people being born with it if it's a specific thing in a specific area. Is it genetic? Well, you would be able to kind of pinpoint that if that was the case, right? Because you'd be able to look at that person's genome and say, oh, okay, this is what's missing. It's just they don't have enough information on it. So all we can do is hope and pray that eventually they can figure out what it is, because once they're able to figure out what it is, then we can figure out, is this something we can prevent? Is this something we can cure? There are treatments. There's like, again, surgical procedures, like some people can have Botox, because some people with Moebius syndrome can't turn their head to the left or right, right? These muscles are stiff, they can't turn their head. And so they can get Botox injections in certain areas or in their face to relax it, because like maybe this side is contorted and then this side is paralyzed. So it's because every person presents uniquely with their own unique set of symptoms and challenges. That's why it's so important that as a clinician for myself, that I think outside the box and I think about how can I help this specific individual. Um, but yeah, and a lot of it has to do with just providing a sense of understanding to the parents and the individual, right? A community of people that can say, yeah, these are challenges that you have, but you are also one in a million. You can also do all of these amazing things in spite of this challenge, and to provide the awareness. So yeah, that was a great question. And thank you. So we are pretty much at time. If we don't have any more questions, I will go ahead and let you go. I want to thank you.
Question.
Okay.
Hi. So, as an individual in the education field, how would or do you have any thoughts on the adjustment for patients that present in school, that are not getting private, per se, SLP services? We only get like 30 minutes. How would I adapt, or what are your thoughts on that?
Right. So that's where advocacy really comes into play, because with a child who has something like Moebius syndrome, because it's so unique, 9 times out of 10, unless that speech pathologist or school nurse or occupational therapist at school, physical therapist at school has worked with someone that has Moebius syndrome, which is not likely, then they are going to be uneducated about how to work with the child. The teachers and the staff and maybe even administration is going to be uneducated. And that's the difficulty for the parent, because now they're kind of tasked with going in and educating all of these people about their child's disability, as if, you know, just being the parent wasn't enough and trying to support your child. So that's one of the reasons that I'm doing what I'm doing. But the other part of that is trying to advocate as much as you can for your child. We know that if you are a parent and you've advocated for your child before, we know that it's not always, you know, received with a happy face, but it's necessary. Educating the teacher about, listen, my child isn't, it's not that they don't want to participate. Maybe they're having some emotional or, you know, those psychosocial difficulties with engaging. They don't want to stand up and read because their intelligibility isn't very, very good, right? And that's where you have to challenge the professionals to do what professionals should do, which is go out and educate themselves once they find out that they have a student with something that they're not very well aware of. I've worked as an SLP in the schools, and I actually had a student with Moebius syndrome, and it was nowhere in their chart. Nowhere. They had autism as well, and that was on the chart, right? Other health impairment, and they're getting this 30 minutes, but is it very helpful? And he was very mild. He was very mild. He has some articulation difficulties, but had I known that he had Moebius syndrome, I probably would have taken a different approach to his articulation therapy. And so fortunately for me, I got to talk to the parents, and that's when I found out, and I was like, oh, unfortunately, it was the end of the school year. 30 minutes is not enough. Twice a week is not enough to really improve the speech of someone who would have, like if they have a more severe deficit when it comes to like their facial paralysis and things like that. And that's why challenging any therapist and or medical or health professional to provide information on why they are selecting and choosing to treat at, you know, the frequency and intensity that they're choosing to treat at is important, because they should be able to provide evidence-based information and tell you this is why this is going to be effective, and this is how much therapy that is needed. Um, I know that in the schools, a lot of times we're overwhelmed, but that is not your problem as a parent. Your goal as a parent is to make sure that your child gets what they need from that school system. And so advocacy is huge and education is big. So I think that ultimately, if someone was to say, as an educator, this child needs speech therapy twice a week for 30 minutes, my question would be, how is that effective for someone with this particular syndrome, these physical limitations, and why twice a week and not 4 times a week? So that would be my question. And as an educator, I naturally would challenge myself to learn more about it. And I would challenge my administrators to have our other specialists like myself, speech pathologists, occupational therapists, and physical therapists, provide in-service presentations like this one so that we can educate all of the staff about disorders such as this one. That's a great question. Thank you so much.
Thank you. And I'm glad to know that your services outside of school may be available to us. So thank you.
Yes, absolutely. Thank you so much. So if we don't have any more questions, do we? No? Okay. Thank you all for joining. I really appreciate it. And hopefully I'll see you at the next. Yes, comprehensive care. Yes, yes, Dr. Randy, absolutely. Comprehensive care. Yes, yes, yes. And that's what that multidisciplinary team should be providing, comprehensive care. And that requires staying up on your research. and professional development. So thank you all so much. I really appreciate you for coming, and I'm going to end this here, but we will be having another Join the Conversation chat in February regarding cultural competence. So I will hope to see you there. Okay, goodbye. Thank you.